Assalamualaikum warahmatullahi wabarakatuh. Hi, I'm Dr. Linda, founder of Skyhi Clinic Malaysia. I'm a certified advanced hormone therapy practitioner by International Hormone Society of Belgium and has been practicing for the past 10 years. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Salam ceria, salam sihat selalu kepada semua penonton-penonton FB Live pada pagi ini. Alhamdulillah, syukur kita bersiaran sekali lagi pada hari ini, hari Ahad. Masya Allah, hari Ahad 20 Jun 2021. Sesungguhnya Happy Father's Day to semua yang menonton, kepada semua bapa-bapa yang menonton. Sekali lagi, selamat Hari Bapa. Celebrating Hari Bapa ini di saat lockdown ini, just semestinya kita boleh raikan semeriah-semeriahnya seperti tahun-tahun yang lepas, insyaAllah. Alright, terima kasih sekali lagi bapa-bapa, stay healthy, stay focus insyaAllah untuk kepada semua bapa-bapa, kerana topik hari ini sesungguhnya bukan untuk bapa, bukan untuk fathers yang menonton, kerana topik kita hari ini ialah untuk wanita, Masya Allah. Tetapi bapa-bapa yang menonton, sesungguhnya di belakang anda ada juga wanita-wanita. Mohon justru itu anda boleh menonton and join us, insyaAllah. Alright, sekali lagi saya doakan semua yang menonton berada dalam keadaan super sihat. Alright, sekali lagi kita doakan kita semua dilindungi dengan keadaan yang agak mencabar di ketika ini, insyaAllah. Baiklah, justru itu topik istimewa yang saya pilih pada hari ini ialah, walaupun tetamunya sudah bersedia di dalam studio, tetapi topik dulu. Apakah topik kita pada kali ini ataupun minggu ini? Saya pilih khas untuk wanita semua. Topik hari ini wanita dan kaitan kekurangannya zat besi dan kaitannya terhadap immune system. Right? Women and iron deficiency in regards to immune system. Right? InsyaAllah. So itulah topik yang saya pilih. Sebelum saya menjemput tetamu saya yang telah sedia berada dalam studio, insyaAllah saya ingin kongsikan kenapa saya memilih topik ini. Saya rasa ini sangat penting. Baiklah, saya raikan dulu kepada Puan Amin Husaini. Masya Allah, bapa pertama yang menonton kita pada pagi ini. Semoga dipermudahkan urusan pada pagi ini, hari ini. Terima kasih Tuan Amin Husaini. Sekali lagi, why I choose this topic? Ada dua sebab utama saya mahu kongsikan sebelum saya memanggil tetamu kita yang sudah bersedia. Setahun yang lepas, saya rasa pengalaman saya dalam screening ataupun melakukan kita panggil test screening iron ini, saya dapati 1 dalam 3 wanita mengalami masalah kekurangan iron. Saya mendengar wanita yang kekurangan iron ini, kekurangan zat besi ini mengalami pelbagai masalah yang mereka kongsi dan rintihkan bersama doktor saya khususnya. Justru itu saya melihat topik kekurangan iron dan zat besi ini sangat penting di kalangan wanita kerana 1 dalam 3 wanita mengalaminya. Sebab itu topik ini sangat dekat di hati saya kerana kita dan tim kami merawat dan melihat sebenarnya berjumpa dengan ramai wanita yang kekurangan zat besi ini, merintih dan kita panggil Masya Allah, kita panggil merintih untuk mendapatkan bantuan. Ya, itu yang utama. Yang kedua, kenapa saya katakan topik ini sangat penting? Kerana apabila kita melihat wanita kekurangan iron ini ataupun kekurangan zat besi ini, kami mahu bantu kerana terdapat rawatan yang kami boleh kongsikan. Justru itu disebabkan ada rawatan dan keduanya penting untuk kita screen ataupun kita lihat pada wanita yang mengalami kekurangan zat besi ini ataupun status nutrisi zat besi ini. Justru itu saya terpanggil untuk bercerita ataupun memanggil ataupun kita ada tetamu yang istimewa daripada jauh daripada Singapura. Dengan ini saya mempersilakan Timothy Cushway. Dipersilakan Mr. Tim. Hi Mr. Tim.
Hi Dr. Linda, lovely to see you. Thank you for inviting me.
Oh my dear, thank you. Thank you for accepting the invitations, Mr. Tim.
Sure.
I hope you are good. How's Singapore?
Singapore today is very warm.
What? Good. We are clear and sunny in Kuala Lumpur. Right. So, right. Again, thank you for having us. Thank you for accepting the invitations. I'm happy to be reconnected, Tim. Seriously, we have not been seeing for quite some time, to see each other online for quite some time. Right. So again, before we proceed, I would love to say again, welcome to the show, Mr. Tim. And again, let me introduce who is Mr. Tim before we proceed. Are you all ready? Okay, Tim. So Mr. Timothy Cushway, or I call him Tim, right? He is actually a founder of the Iron Suite in Singapore, which is Asia's first clinic focused on managing iron deficiency. Is actually good to say that, Tim. All right. So he has actually more than having experienced more than 20 years, I can say, in this field. This Tim is also passionate about delivering outstanding services to ultimately important or improve quality of life to patients, Mr. Tim. All right, with that, I think everyone, especially women, are ready to hear your sharing about this topic, Mr. Tim. Like, all right, so let's start. Before that, how do you find having to be here this morning, Tim? Please say something.
So it's an absolute pleasure to be here this morning, and I can't emphasize and support your comments strongly enough. This is iron deficiency affects so many patients and people around the world. It's one of the It is the most common nutritional deficiency and probably the least commonly diagnosed. So it's great to work with like-minded individuals like yourself who are so passionate about correcting this deficiency. So I look forward to being able to share some more information and hopefully address questions from your audience.
Sure. Yeah, we have 1 hour with Mr. Tim this morning. We hope that we entertain questions later. But before that, we will ask Tim that what we want to know about why iron is important, why is it women get this iron deficiency, and who are at risk, and most important, how to manage. Am I right, Mr. Tim? Let's go. Is everyone ready? Let's go. Thank you for those who are joining us. Thank you again. Somebody commented, zat besi, which is iron, is let me say, he was trying to say is important in women and common sickness that especially early symptoms. Thank you, Mr. Amin. All right, so let's go. Tim, knowing this is important topic, we would love to know, right, why is iron is important, why iron is in need for human body, right? So before we know what is the symptoms of iron, we got to know first why is iron is important to a body needs, be it women or men, but of course the topic to women, of course. All right, let's go to the first slide. Maybe Tim will be enlighten us for all this topic, the answers. All right, Tim, over to you.
Perfect, thank you. So if we go to the next slide, I think what we can see here, and this, I do apologize, it's from a medical textbook and it's quite complex. But if we make this much, much easier for the layperson, what we can say is in the human body, there's roughly 3,000 to 4,000 milligrams of iron. About 50%, so about half of the iron in our body is in red blood cells or in the blood. And for every 1 ml of blood, it's 0.5 milligram of iron. So you can understand that iron deficiency is quite often associated with something called anemia. But this is also a limitation because anemia is so commonly caused by iron deficiency. Many people believe that anemia is when we need to worry. And I hope that I can talk a little bit more about that, because iron is critical not just for our red blood cells, but for pretty much every cell in our body. It's needed for oxygen storage, it's needed for energy, and probably most importantly, or at least very importantly, it's also needed for our innate immune system. So we can't make iron as humans. We have to take it. So it usually comes from our diet. So every day we get about 1 to 2 milligrams of iron through our food, so what we eat. And at the same time, we lose about 1 to 2 milligrams of iron. We can lose it through sweating or skin falling off or our gut system, shedding of the cells and the lining of the cells. But in essence, we should stay in balance. The problem is when we lose too much or we don't get enough in, because again, we as humans can't make iron, and we also can't destroy it. So we can't actively release iron out of our body. So it's so important that it's in this nice state of equilibrium.
Yes, I think that's a very nice introduction, Tim, why iron is important, because we can't make iron. The body can't make iron. I agree with you, and it's so much essential for life. It's the same thing like the body can't make vitamin C. I think you agree with that, right?
Yeah.
For sure. So that's to start with. Looks, everyone, women, ladies, we need iron, right? Men also, we need iron. Because of that, Mr. Tim has so much reason why women is so common in getting iron deficiencies, right? Before that, how we would love to know to diagnose this iron deficiency, Tim. Maybe we can go to the next discussion. Why is it the diagnosis to know that to laymen out there, Tim? Why they need to know, what do they have to know about this diagnosing or knowing that, look, I'm iron deficient, all right? What do you know? We need to explain to the layman. Please, Tim, over to you.
Yes, thank you. I think this is very, very important as well, and it's an age where, as patients, we need to be self-powering ourselves. We need to know about these things and not 100% relying on your doctor. Of course, they're the experts, and working with experts in the area is important, but it's also important to understand yourself and take care and take leadership in your own well-being. And in terms of iron deficiency, unfortunately, back in med school, we often just learnt about anemia, and we have this term called iron deficiency anemia. But again, I want to come back and move away from the term anemia to how do we look at and diagnose really iron deficiency. And the key marker that we use is something called ferritin. So FER, or fer, relates to the old Latin for iron. So the best way to remember if you're going for a blood test in the future is to just think of the iron in the tin, ferritin. So ferritin. Wow. So the iron in the tin. So this is something that we find is very helpful, and you always need that little reminder for yourself. Yeah. But if you're going for a blood test to check your iron, and I would highly encourage, especially at-risk patients who come to who would be most at risk, but I would highly encourage you to do that at least once every year or two. But ferritin's what you should be asking your doctor for. Ideally, your ferritin level is somewhere between 100 and 300, but when it falls below 30, that's what we call absolute iron deficiency. That means there's no longer enough iron in the bone marrow to support proper function of our red blood cells or any of the other cells in our body. So once that value falls below 30, that's when we really consider to have a very negative state. Between 30 and 100, we would say your iron stores are becoming low and we need to take action. And those times, maybe we don't need to be as aggressive in our treatment, and it's a little bit easier to manage a patient. But ideally what we want to see is somewhere between 100 and 300 so that everything in the body is functioning perfectly well.
Wow. I think what we're trying to say, Tim, we should know, every woman should know about their ferritin. Can I say that? All right. Hence, it's a simple blood test to be done. I mean, we will say that how to get this ferritin out of it. I mean, everyone would ask the next question then. But what I'm trying to say, we as a woman, as a patient, or as a man as well, just ask the doctor about this ferritin, because if you, as Tim was saying, if you know in a normal medical checkup, mainly if you include the ferritin test or ferritin level in the test, would be very useful. Can I say, Tim? Right.
Definitely. And again, do as a patient, make sure you ask your doctor for this. Unfortunately, at least in Singapore, and I think the same in Malaysia, not all clinics are as advanced as you are, Dr. Linda, and doing this routinely for their patients. Okay. So there are a lot of clinics that don't do it. So it's important to understand and be able to ask.
Well, you're right. You're trying to say we can put it as our screening routine medical checkup that we're doing.
Yes.
Good,
Yes.
Tim. All right, with that information, ladies and gentlemen, yes, we entertain questions later. We would love to go to the next questions to Mr. Tim. That what is it? How can why women having, since we've been talking about women and women again and iron deficiency, and in regards to the immunity, of course, we talk about it. But why is it in general women are more susceptible to get than men? And what are the symptoms and signs that we love to know if one woman has it? Maybe we don't realize that, look, I'm having iron deficiency, not just you having anemia to that extent, but what else women should know? Please, Tim.
Yeah, so it's an excellent question, and in our clinic here in Singapore, we have a chart on the wall. It's now on the on the slide here. We have it at 2 meters tall, so a little bit taller than me.
You do that? You do that?
Yeah.
You have that on your wall?
On our wall, that's right.
Wow.
And we find this is so important because so few people, but and to be honest, clinicians and lay people are unaware of just how common and how many signs and symptoms there are that are associated with iron deficiency.
Wow.
The number 1 and 2 that we would get from most of our patients will be hair loss, which is mostly women, clumping of hair, or the husband's complaining that the drains are blocked, and fatigue. And fatigue can be getting tired at work, sleeping but not feeling rested,
Wow.
Dizziness when you stand up, or lots of sort of non-specific symptoms. And these all occur as the ferritin starts dropping below 100. From a medical aspect and a clinical aspect, I mentioned before, absolute iron deficiency is defined as less than 30. But that doesn't mean that we don't have patients and don't see patients with symptoms even once their iron gets low, so below 100. But once we start falling below 30, that's where we see things like more frequent infections, so more likely to pick up common cold, or potentially experience worse symptoms from if one was unlucky enough to acquire COVID-19 or to be infected with COVID-19. So frequent infections is just another way of saying our immune system, our innate immune system, that first line of immune system, is not strong, or not strong enough to help us really fight off these infections. And we do also see other quite serious and different levels of symptoms and signs, from depression and concentration impairment. But the key, you can see there, anemia is right down the bottom. So it can take a good 5 to 10 years of all these signs and symptoms that many people may pick up and say, well, it's just because I'm working too hard, or I've got a young family, etc. And it's only when anemia is detected that somebody may go in and look at your ferritin, which is why I encourage you to do that at every screening, because you can maybe avoid 4 or 5 years of some of these symptoms.
Wow, that's important, Tim. I guess on top of the first symptoms, or the first women to suffer is a hair loss, till women having anemia, or at the extreme part of it where they get this anemia where they have pale, or they have lethargy. Well, and you mentioned about anemia, many women are aware about it and they know their HP. But when you talk about ferritin, they might not be, we call it a little bit aware about their iron level, how much my iron status in the body, right? So that's so much important, from the extreme out of it, from the hair loss, from the headache, as what Tim was saying. We got so much so the spectrum of the disease that we want to say, like the simple, that it's just like the tip of the iceberg concept, right, Tim? Right.
Correct.
So we want to make sure that, look, if you have, we don't want to just go or till the tip where you have anemia, right? Hence, we want to treat before many years that it's a journey. I always tell my patient, Tim, it's all about a journey that you've been going through, that it takes many years, as Tim was saying, to get anemia. Hence, you may have been suffering from iron deficiency. That's the main information that Tim was trying to explain. Right. So on top of that, we know the symptoms is actually can be very even more sinister in women anyhow, though, right?
Mhm.
On top of being the low immune system, on top of being, as we know the topic today, to boost women's immune system, but it can be more sinister that we know, Tim. Tell us more about why deficiency in iron affecting them.
Yeah, so iron deficiency there's a lot of emerging data, especially in the last few years, that is demonstrating that iron deficiency, and here we're often talking about iron deficiency before the onset of anemia. We're talking about 5 to 15 years of having undiagnosed and untreated iron deficiency, that it can then start to increase the risk of morbidity or of developing worsened diseases and or mortality, so increasing your risk of dying. And just to give you an idea, its latest data would suggest it's about a 58% increased risk of all-cause mortality, so dying for any reason, versus the equivalent person who doesn't have iron deficiency. But if I just go into some of the morbidity or the increasing risk for other diseases, one that's still very strongly linked and hypothesized here is that chronic iron deficiency, so iron deficiency over a long time, is starting to reduce bone resorption. And obviously in women, we're always worried about the risk of osteoporosis. So the increased risk here for resorption and osteoporosis is already a single reason to think about iron deficiency and managing it. From there, we also have other quite serious issues that are associated with iron deficiency. Another recent one, only published a few months ago, was the finding that the role of iron in the heart, so heart being obviously a muscle and one of our most important muscles, that iron deficiency, again, over a long time and chronic, not iron deficiency because you've had a hemorrhage or you had a major surgery and it hasn't just one time, but having iron deficiency that stayed there, it hasn't been either diagnosed or hasn't been appropriately treated, it may also increase the risk of developing or exacerbating heart failure, so damaging the heart, unable to pump blood, etc., as needed. And from there, we then go to the topic of the day, which is then innate immune system. So there's multiple studies, and I've just chosen one here that was actually in older adults. And I've chosen older adults because, of course, the higher risk for COVID-19 and worse symptoms. But it's equally important for a young adult, male or female, but iron deficiency mostly affects women. But it's so important to have that iron to enable the innate immune system, to enable those cells to mature and be able to support our defense, our first line of defense, and avoid bacterial or viral infections. But even possibly more important is our innate immune system is also what helps us clean up when our body makes a mistake. And I'm not sure if everyone's aware, but basically cancers are often formed because our body makes a mistake. Our immune system hasn't been able to clean up that error, and that error then replicates and ultimately grows into what we call a tumor, so cancer. So iron deficiency has been known or been linked and shown in multiple studies, and the one that's on the screen there was more than 30,000 patients in that clinical trial out of Taiwan. But iron deficiency has been shown to impair the molecular and metabolic functions of cells. It's just a fancy way of saying our body isn't working properly. Our cells that are so important for keeping our body healthy are not active, and it increases the risk to human cell carcinoma or carcinogenesis, or having a chance to develop a cancer. And I think just literally a few weeks ago, probably just over a month ago now, there was also another study that was published that the evidence in that study suggests that, again, iron deficiency, low iron, not treated, was the reason for developing, in this case, a colorectal cancer. Yes, so obviously there's many reasons for developing cancers, but the stronger our body is, the better we can fight off everything from our immune system, but also in the importance of the heart and our bones. So it's not something that's just a little bit of hair loss. It does have, unfortunately, some quite sinister side or potential consequences for a undiagnosed or untreated patient.
Wow. Well, Tim, this is huge, and explanations, even not for laymen or for women, is for doctors too, right? I'm surprised that you came up with all these studies as well, but it shows to us, look, as Tim was saying, it's not just simple as you losing hair in women. It's not just you feel fatigue in the morning or after you do exercise. It's more than that, the risk of getting, if you remain low in iron, if you remain iron deficiencies, it has major potential risk of all the other system. I agree with you, Tim, especially with the current situations of this pandemic COVID. Of course, we all know that we want to boost our immune system for all the measures that we want to do, but one of many reasons, one of many, is not one of only. Please don't get us wrong. Please get it right, because iron also nutrition matters in immune system or immune functions. That's ultimately what we want to say today, right? Ultimately, what we want to explain today regarding the iron deficiency in women, especially having this potential health risk. I think that's important to get through, Tim. I think I would love to share to those who like to have this slide. You don't mind, we can give some of the slides if you all in need. All right, we are happy to share that. Is it all right, Tim? Not to
Absolutely.
worry. Those who really keen or would love to know about it, we would love to share this slide too. All right. So I guess I'm getting there. I'm getting there, meaning I'm getting excited to know, like, well, we know how potential important of the iron in the body. We know what are the symptoms. Now we got to know, look, who are at risk. All right. Yeah, we talk about women, but men too at risk. But what is it you say, Tim? Please, who are at risk actually?
I think it's obviously the big question. Who are the at-risk patients? Because anytime we do a blood test, and I see that there's one of the questions is, beside a blood test, how can we diagnose? At the moment, unfortunately, we are really limited to, we need to do this blood test to really check the ferritin. There are some experimental research on looking at iron in hair and some other aspects, but it really comes down to looking for an iron panel and looking at the iron in the tin, so the ferritin.
All right.
Potentially also transfer and saturation, but we can come back to that when we get to the questions. But if we look at who's at risk and what causes iron deficiency, it's mostly women. So if we look at females, and I've tried to take some local data here, globally it's around 38%, or about 1 in 3 women will have iron deficiency. And now this is taken from a general population, not patients hospitalized, not patients who are sick. We're talking about if you do epidemiology style studies, i.e. go into the community and draw blood from otherwise healthy women, you'll find about 1 in 3 will have serum ferritin levels below 30 nanograms per mil. So really what's called absolute iron deficient. And if left untreated and undiagnosed, increased risk for multiple comorbidities. Unfortunately, there was always the belief that because iron deficiency is mostly caused by menses, as we get older, or as women got older and stopped having menses, that maybe the rates of iron deficiency would decrease after the age of 50 or 55. But unfortunately, that's not what we're seeing. In fact, the rates continue to increase, and it may be a bit of a mix of the number of women becoming iron deficiency over the journey of their childbearing years, but it's probably also complicated because of when we get older, we often have other diseases, we're taking medications, and all of these could be reducing the amount of iron we absorb. So you remember right at that first slide, I said we need 1 to 2 milligrams in, and there's usually 1 to 2 milligrams out. Women of childbearing age, it's often from menses, so there's more than the 2 milligrams out. But as women get older, they're no longer losing blood, but they're maybe not getting enough in. And I think a special population that's definitely worth mentioning is the pregnant women. There was a study of roughly nearly several hundred patients in Singapore recently, a few years ago, and they looked at the women who were pregnant, and most actually were taking oral iron supplements, but they tested the serum ferritin in the third trimester, at the beginning of the third trimester of pregnancy, and they found that 3 out of 4 pregnant women were iron deficient. So they had serum ferritin less than 30. Some were anemic as well, some were not, but the iron deficiency rates were exceptionally high. And for within pregnancy, there's a lot of data on why iron is so important, both for the mother but also the baby. But even if we just take one of the most simple aspects of pregnancy is the woman's, when she delivers, she's reliant on the muscles of the uterus to help, especially after delivery, to stop all of the vessels from continuing to bleed. If those vessels and if those muscles don't clamp down strongly on the blood vessels, we have what's called postpartum hemorrhage. And this is why, for me, I believe, and my wife, we have 2 children, she was treated with intravenous iron in both, ahead of both pregnancies. But I do believe it's so important to make sure we're not going into delivery of a birth in a hugely iron deficient manner. So again, a very, very big at-risk population. But if we skip to men, this is where I guess guys were a bit more lucky. The rates of iron deficiency in men of that so-called equivalent to women of childbearing age is almost non-existent. To be honest, if we see a patient at our clinic who is male and iron deficient, it's a red flag. The cause of iron deficiency is going to be from blood loss. So you can argue that checking ferritin also for men is perhaps not necessarily a bad thing, because if you do pick it up, it could be a very early warning that there's a bleeding. We have actually picked up a man who had ended up having a colorectal cancer, and we were able to pick it up at a very early stage, which enabled him to be treated. So whilst I wouldn't say that men of that age are generally at-risk population, there is still benefits of knowing your iron levels. But again, as men get older, and it's similar to the women of that same age group, of 55 or 60 years old, we start to have many other diseases, taking lots of different medications for this and that, especially if we don't live a healthy life, which then increases the rates of iron deficiency because we're not getting enough iron into our body.
Wow. From my experience, Tim, I shall say during 1 year of me screening, for the past 1 year while I was screening iron in my patients, I have one particular man having low in iron, whereby I can say the risk was a little bit on the vigorous activity, the exercise. Maybe I can share to you, right? So as you say, it's uncommon, but still, if you pick up earlier those who have risks, like as you were saying, colorectal cancers, where men are bleeding in such a way, it's very good to pick it up, right? So that's great. So please come, all the questions. We welcome all the questions, please, and those who please stay with us till the end, because Tim will entertain questions later. Right? So yes, please come in. We welcome more questions. Right. So Tim, let's move on. All right. We almost 40 minutes reaching after 11. We will entertain questions in about 5 minutes or so. Allow us to Tim to share a little bit more on after we know who are at risk, now what about women the most common, which is the menstrual bleeding, and the key words is heavy menstrual bleeding. Tell us more about it, Tim.
So thank you. Yeah, obviously we could see from the previous slide that women are at the highest risk, and the number one cause of iron deficiency is heavy menses, or heavier loss of blood from the monthly menstrual cycle. Now, heavy menstrual bleeding is a very difficult one to simply define. And there are multiple different definitions of heavy menses with the different societies of obstetrics and gynecologists. But in our clinic, and we follow this simple questionnaire, which is also a validated questionnaire for the definition of heavy menses. And obviously everybody can read the slides, but if you were to have, if you could say yes to 2 of 4 of those points, so for instance, passing of large blood clots, or the need for double sanitary protection, need for frequent changes of tampons or towels, or flooding through to the clothes or bedding, if you could tick 2 of the 4, or 2 or more, this would generally now be considered having heavy menses. And if we just do the very basic maths, heavy menstrual bleeding used to be described as having more than 120 mils of blood loss. But even if it was just heavy, but not as severe as fibroids, etc., causing those massive losses, we could be talking about 100 mils of blood being lost every single month. And as I mentioned before, 100 mils of blood is 50 milligrams of iron. So if you multiply that by 12, that's the equivalent of 600 milligrams of iron lost every year. And if anyone remembers the very first slide, it's an average woman has about 3,000 milligrams. So now we're talking 1/5, 20, 30% of that woman's blood, iron stores is being lost every year, which needs to be replenished by food or by iron sources. So it becomes a very difficult one to keep that balance and to not fall into an iron deficient state. And this is definitely the number one reason that we see. And I think,
yeah, you're doing the maths calculations for us ladies. I appreciate that, Tim, right, for that calculations. I'm afraid we don't do we don't do those calculations yet.
No,
I mean,
it's obviously a very taboo subject, even amongst women. But it can have quite serious and significant consequences. So I think it's important that people can be aware again. Could they have that? And it helps you as an individual maybe understand your own body.
We don't say that we hate menses. We don't say women you have to avoid menses, of course, for many reasons, but that's mainly the simple maths or calculations Tim was trying to say. Look, it must be in balance. Be in balance. I agree from the first few slides or first that our discussions, we're saying that always be balanced about the loss and of course the demand and the needs and the loss of every day or monthly of iron that we need. Right. How about in pregnancy, Tim? All right. So what else? Yeah, please.
Yeah, pregnancy is definitely the second biggest risk factor for causing iron deficiency. And in essence, the key thing to think about for any pregnancy is about approximately 1,000 milligrams of iron will be required to support that birth. So again, average woman has roughly 3,000 milligrams.
All right.
That process of pregnancy, you're using up about 1,000 milligrams, or about a third of your iron stores. So one of the very often one of the common cases of patients we see is either during pregnancy, where we do with intravenous iron or oral iron if it's slightly earlier in the pregnancy, but more importantly is postpartum. It's quite common, especially on a second baby, because the first one's taken 1,000. Let's assume you're in a healthy state at the beginning, and we know that 1/3 aren't. But on the second baby, you've already lost 1,000. You go into pregnancy again, especially if it's a short duration between children or between pregnancies. And this is why iron deficiency is so common, either during pregnancy or in the medium postpartum period.
All right, so we saying that we do treat women during pregnancy with low iron or deficiency in iron as well, right? Because the demand is so much increased, right? All right, so that's great. Thank you, viewers. We saw some questions coming in already. Let us finish a little bit more of 1 or 2 slides, I shall say. Tim would love to share with us. Hence, Tim, how do we manage this low iron or iron deficiency? What do we do? I have lots of questions before this live. We started our live. Look, doctor, please tell us about which one is a good iron, which one that I have to take the iron pill, all those questions. But before that, allow Tim to enlighten us about how to manage iron deficiency. Please, Tim.
Thank you. I see there's many questions also asking about how much iron do I need, which is a very common question. I'll try to address that in a moment. But I think it's first of all, I think the most important thing whenever you suspect you could have iron deficient is maybe think about also which clinics you're going to visit.
All right.
Unfortunately, medicine is obviously a lot of information for doctors. And iron deficiency is not always the key topic that the doctor might be aware of. So fortunately, somebody like Dr. Linda and the Sky Hill Clinic are treating and managing iron deficiency. So there's a centre. But I think it is important because there are multiple ways to treat iron deficiency and they don't always all work. So for instance, our diet is a fantastic way to maintain our iron levels. If we're a little bit deficient, our diet can be a great way of getting us back to normal, which is why earlier diagnosis, maybe diet alone is enough. And even, and we often have questions of, well, I'm a vegan or a vegetarian, does that mean I have to be iron deficient? Absolutely not. Vegans and vegetarians can have a very good sustained iron intake, but they need to it's a little bit more, you need to be more cognizant of what you're eating and how you're eating it. Heme sources or meat, whether that be anything from meat to beef, pork, chicken, liver, but even seafoods, etc., all heme iron. Any animal-based food is a source of heme iron. Heme iron is more easily absorbed by the body because we have a specific mechanism for absorbing it in the gut. But after diet, which most times is probably not enough to treat iron deficiency. If we're now talking a ferritin of under 30, it means that your doctor will often have the option of either oral iron or intravenous iron or parenteral iron, whichever you want to call it, where it's injected into a vein. So both oral iron and intravenous iron can be quite effective. Oral iron you need to take for a lot longer period of time because it's a tablet. It also means, because it's a tablet, if you have an absorption issue, if the problem isn't due to your diet and you do get enough iron in your diet, just taking a tablet might not work. And we know for a lot of patients it doesn't work, especially those who have other diseases or taking some other medicines. So then you may need to consider intravenous iron.
Wow. So we have a spectrum of managing iron is either from diet itself, or you put iron pills, or depending on the severity, or when you need IV iron, the doctor will help you. Right. So what's the benefit of IV iron usually?
So maybe I can touch on oral and the intravenous iron.
Yeah, the oral first. Yeah.
If we think about oral iron, the evidence, and I think this is a big finding, especially in the medical fraternity, and not all doctors are fully aware of this, but lower doses are actually better. So if you are taking oral iron, and especially if you're getting the side effects, reduce the dose. You really don't need to be taking 2 to 3 tablets. Most people, 1 tablet, so around 40 to 60 milligrams per day, or even every other day. Just take it 2 or 3 days per week. You'll probably find you'll have less side effects. You don't really need to take it with orange juice or vitamin C. I know nearly everybody always says, and every time you look on the internet, take vitamin C, it improves iron absorption. That is correct. Vitamin C improves iron absorption because it makes the gut more acidic. However, when you're taking oral iron supplements, especially of the 40 to 60 milligram therapeutic range, your body can't absorb that much of it. So adding vitamin C, what you end up is causing more side effects than benefits. So oral iron, I think less is more.
All right.
Second point is, if your doctor's prescribed you oral iron, and he or she hasn't booked you for a repeat test of your ferritin, and or hemoglobin, make sure you do it. Go back 2 or 3 months later. Don't just keep taking it for 6 or 12 months without knowing it's working. Unfortunately, it won't work for everybody because it must be absorbed in the gut. So important to, again, take control of your own health, follow up, get that repeat test. And then if for whatever reason it's not working, you may need to consider other routes of getting iron, such as intravenous.
Iron,
Yeah. So if we want to maybe just continue on to the intravenous, I'll just quickly go through the intravenous iron. Or
sure.
do you have any questions that you wanted to ask?
Yeah, I think that's fair enough, Tim. Can we go to the intravenous iron? Because oral iron, I hear you, because it's like it takes many months to get the results. But the most important here, I would love to highlight here that go back to your doctor to repeat the blood test, the iron, whether you have enough or not by taking oral pill or the oral iron. That's the main thing that Tim was trying to say, right? Not just remain or assume that, look, I think I'm good. I think I have enough iron for now, right? I think that's the main important message on that matter. All right, how about IV iron?
So IV iron, which is, as it would suggest, intravenous, meaning into the vein. The key difference here is most drugs affect a part of our body, and they, for instance, block some pain receptors so we don't feel pain. When we give intravenous iron, and there's a few specialist clinics, including Dr. Linda, who are doing iron infusions, what we do is we inject iron, and again, iron is an element, so we're injecting iron directly into the bloodstream. And how the products are made is there are elements of iron with a carbohydrate shell. So what it does is it injects that iron directly into your body. Once it's in your bloodstream, it's then absorbed naturally, so that doesn't affect any pathways or anything like that. It's almost like TCM or something along those lines. It's really just a way of getting this element into your body. And most importantly, when you give it intravenously, it means you get 100% of whatever is injected. And I think this is really important, again, for knowing your own health and following up, because most times you will need iron. So if your ferritin is below 30, and especially if your ferritin is below 30 and you're anemic, you will need somewhere between 500, 1,000, possibly even 1,500 milligrams of iron. There's multiple different products available. Some of them you can only give 100 or 200 milligrams in one injection. Some you can give 500, some you can give 1,000, some you can even give 1,500. So here, it's again important, check with your doctor, ask him or her, how much iron are you giving me? Make sure to understand that you know a little bit, and if your ferritin's below 30, you will always need at least 500, probably often needing 1,000. But in our clinic, for instance, we take the approach that if a patient has a serum ferritin less than 30, their hemoglobin is sort of normal, we'll give 500. If the hemoglobin's been impaired, so we're right at the end of the cycle of iron deficiency, so very severe iron deficiency, we'll give 1,000 or sometimes even 1,500 milligrams. And I see there's a question asking this as well, how often do you need it? Most of our patients, probably 60 to 80%, would only need one injection, because we try to calculate the need. So we try to give one injection, and we bring the patients back about 6 weeks later and just check. And in the cases where it hasn't been enough, then we'll give a second dose.
Right, that's great. In view of those women who worry about IV iron, what's your advice?
Yes, the old benefits risks. Like all products and all medicines, there's never anything that's perfect. We've done research in our clinic. We've had just over 500. At just over 500 patients. We've treated several thousand. But just looking at about 500 patients over the last 6 or so months, what we found, and we asked a validated questionnaire to all of these patients, asking, do you feel a little bit better, a little bit worse, much better, or much worse, or no difference? And we asked that after just 1 week. And 90%, so 9 out of 10 patients, reported back to us that they felt better or much better within 1 week. And iron, especially when it's injected, it's very immediate. It's incorporated into the body. If you're severely anemic, even to the point we had a patient there not so long ago who would have or was told by her GP to get a blood transfusion. We were able to give her iron, and within 1 week, her hemoglobin had come to above a threshold where she was no longer needing a blood transfusion. So iron can be utilized to avoid blood transfusions, but you'll generally see many of the patients feel much better within a week or so. Hair loss, which is the usual question we get, well, how quickly will my hair loss resolve? You normally have to wait for about 3 months. Sorry. Obviously, you've got to wait for the hair follicles to replace and to come through. But feeling fatigued or having that sort of spaced out brain approach, or even sleeping better or avoiding restless leg syndrome at night, this is often resolved within days or a week or so. On the other side, of course, there are risks, and I think it's important that people know if you are going for an intravenous iron about these reactions, because they're really mild and they're easily managed by experienced sites and experienced doctors. So you have about 1 in 10 have these so-called fishbone reaction, which just means you get a little bit of flushing. So you'll see the redness come up in the neck and then possibly into the face. Sometimes it's this feeling of chest tightness or a little bit of what feels like back pain. They're usually quite mild. If you are receiving intravenous iron, be aware of them. Don't panic, but do inform the nurse or the doctor as soon as you realize it. Sites that have experience will pick this up and they'll pause the infusion. So that just means they don't stop it, they don't discontinue, they just pause it. And what you see in as quickly as 30 seconds, but nearly always within 5 minutes, it completely resolves, which means that after it's resolved, you can then continue with the iron infusion. And at least in our center with several thousand patients, we've never seen the reaction reoccur. So it's a little bit, and we don't really know exactly why these happen, but it appears to be that the iron, when it first touches the epithelial lining, the lining of the blood cells, of the veins, causes a release of nitrous oxide, and perhaps that's causing these hypersensitivity-like reactions. And I guess the other types of symptoms that we see in our clinic are these isolated symptoms of urticaria or rash or hives, less commonly nausea or diarrhea. And again, in these cases, 9 out of 10 times we just pause and it'll go away in the case of the nausea or the diarrhea. Occasionally, we'll give a treatment called hydrocortisone, a corticosteroid, which usually helps resolve it. If it's a rash, we'll give some medicine to antihistamines to avoid or minimize, stop that rash proceeding or growing. And again, we've never had a patient where we couldn't administer the full dose of the medicine. And I think if you need intravenous iron, you need it for a reason. So it's important that you, as patients, we're aware, as well as clinicians are aware, that there is a reason why it's being done, and we should do our best to make sure the patient gets fully treated and isn't left in an iron deficient state post.
Wow. Good, Tim. I think that's mainly comfort the patients who are in lining up for getting IV iron. All right, Tim, shall I pop up some of the comments from the viewers?
Please.
Yes, in fact, we are getting it. We are entertaining the questions very soon, of course. So from Miss L, what she felt that I feel better after my first IV iron, of course, and Alhamdulillah, thank God, I able to come back to my previous activity. Excessive hair fall and extreme fatigue was so bad. I think yes. After you feel it, you can feel the difference after you have the IV iron, even the first dose of IV iron, right? So thank you, Miss L. So right, we are coming almost to 12 o'clock and yet we have to entertain some of the questions, Tim. All right, my admin, please, maybe we can some of the questions that we can see, and some of the questions that Tim also can see from your side. Maybe we can pop up one first questions. There's so many questions here. Let me see. All right. So maybe I choose first. All right. Okay, this one. What is the recommended from Madam Noor Hafiza? What is the recommended daily dose of iron supplements? All right. Tim did mention just now. Maybe you can repeat, Tim, please.
Yeah. So again, often you get told you need 100 to 300 milligrams a day. I honestly believe that you're much better off on doses of somewhere between 40 and 60 milligrams per day. Try to avoid the multivitamins because they don't have enough iron in there. You ideally want to speak to a clinician. Try and get somewhere around 40 to 60 milligrams. Don't take it with vitamin C. Don't take it with your food. Try and take it separately. And if you are taking calcium or you like drinking black tea, avoid those two in particular because calcium and iron, they don't mix well, so your absorption of the iron will be basically wiped out. And black tea or tea with milk, whichever, or even coffee will also bind very nicely to the iron.
Yep.
It means you don't get the iron. So less is more, but you need to take it in the right times and avoid mixing it with other products or foods or drugs.
Yeah, Tim was trying to explain as well the efficacy of taking oral iron as well. I think it's from the same person. I will have to read this from Noor Hafiza again. Madam Noor Hafiza, she was saying that her ferritin was 7. Oh wow! After infusions, it goes to 60. Now trying oral, of course, and see how it goes. Overall, feeling much better than before. Thank you, Madam Noor Hafiza. You should keep going on making the oral iron works for you for now, inshallah. All right, God's will. All right, so maybe next questions. Maybe from Danielle. Thoughts on doctors that you saw these questions, Tim, just now. All right.
Yes. This is an excellent question. This is a very advanced question. So percentage saturation, sometimes known as transferrin saturation or iron saturation, is another marker of iron deficiency. Again, this is the importance of working with clinics that are very well versed and understand iron deficiency. So serum ferritin is a great marker. Nothing's perfect, but it's as good as we get today in a patient who doesn't have any other problems. However, unfortunately, serum ferritin is what we call an acute phase reactant. So in a patient who has chronic diseases, for instance, heart failure or chronic kidney disease or even rheumatoid arthritis or even a common cold, the ferritin can artificially be elevated, which can hinder us in our definition or identification of iron deficiency. If it's low, if ferritin is low, it's definitely iron deficiency. There's nothing else can cause it to be low. But when ferritin's high, doesn't mean the patient doesn't have iron deficiency. So we do often need to look at percentage saturation or transferrin saturation. And the only times really that we would ignore ferritin completely is in very inflammatory settings. So patients with cancer, for instance, often you'll almost completely disregard ferritin. In conditions like heart failure, serum ferritin up to 300 with transferrin saturation below 20% is still considered iron deficiency. That's a very advanced, very good question.
Right, thank you, Tim. All right, from Sarah. Okay, my hemoglobin is 13, but ferritin 19. Yeah, obviously it's non-anemic iron deficiency. We call it. There's two conditions, right? It's either you have anemia or either we have no anemia. Okay, so the same goes to Sarah. And is that after a year of oral supplements? So I'm still considered as iron deficiency. According to my doctor, my numbers am considering in the normal range. So she's asking. However, I still have some symptoms. That's important to highlight that. I would like to know how many infusions mainly to bring up my level to 100? Please, Tim.
Yeah. So the number of infusions is actually product dependent. With the latest generation intravenous iron compounds, you'll probably need one. We would in our clinic probably give, and I'm sure Linda, you would do the same. Would give one infusion to bring yours. I think what the case here is, for me, almost the most worrisome. It's exactly what we see every day in our clinic here. We have normal hemoglobin, so no anemia, but absolute iron deficiency. Ferritin is below 30. Unfortunately, the laboratories that we often use have reference ranges that are a reference of the population. They're not a reference of what it should be. So when a doctor says to you, your ranges are within and it shows you on the labs, in the normal range, it should probably ring a few alarm bells for you, because a reference range is not a normal range. Well, it's normal, but it's a statistical normal. It's not normal what it should be. So it only indicates that a lot of Malaysia is iron deficient. Same in Singapore. A lot of Singapore is iron deficient. So number 30 is very critical to know and to remember, and symptoms should guide treatment anyhow, not numbers. So in your case, I would expect that you will probably need one infusion to bring your levels up, somewhere between 500 and possibly 1,000 milligrams. If you were to, at our clinic, our standard protocol would be to give you 500 milligrams in your case, and then review 6 weeks later. And if needed, which generally 500 milligrams will increase your ferritin between 50 and 100 points.
Sure. Yeah, I agree with you, Tim. All right. How about next questions? We have, hi, Dr. Linda. How often, hi, Tim and Dr. Linda, of course. How many women need to repeat? How often women need to repeat the iron test? All right, that's good. And do we need to continue with oral iron after IV infusions? That's also pretty much great questions. All right, after we do the IV iron, we do repeat the test. Am I right? We do repeat after 6 weeks or so, right? To make sure that the iron or the ferritin goes reaching to 100, of course, right? Then after that, do you continue with oral iron? What do you say, Tim?
So we don't treat. So I think two parts of the question. I'm not exactly sure if Dinesh was asking after treatment or how often do we have to test.
Yeah.
So I would recommend for most women to try and get tested at least every other year, but ideally yearly if you can. If your ferritin's very good and you don't have heavy menses, then maybe you can never do it 2 or 3 years. For somebody who has risk factors for iron deficiency, heavy menses, you might want to check a little bit more often.
Yep.
After it's been treated with intravenous iron, generally speaking, the idea of intravenous iron is to complete and replete the iron levels, to cure the iron deficiency, if you will, with 1 or 2 injections. So most patients won't need to take oral iron. And I would actually suggest that at least until the 6-week checkup visit,
I agree.
Don't take any oral iron, because what's happening is you get the intravenous iron and your body will say, wow, I've just had this massive influx of iron, and it will block the absorption of iron from the pills. So it'll cause side effects but not benefits. So no oral iron directly after intravenous iron.
You're right. Yeah, I agree with you. So we don't immediately take oral iron after the infusions, but we repeat the level after that, so that we make sure that it will having enough, so that we know what's the next action plan or treatment plan. All right, this is great. I mean, I guess it's regarding to men, maybe. We have questions from a man here. Gentleman here, what is your best advice for us during this MCO? Wow, I think, what's your take?
Well, this is always a difficult one. Look, we are what we eat. We're talking about iron deficiency today, but let's face it, nutritional deficiencies are very common. So during an MCO, to be honest, during any time, you should be very cognizant of what we're eating, what we're doing to our body, what's good, what's bad. I don't think there's anything different in an MCO situation versus BC, before COVID. periods.
Yeah, right.
It's something that we need to always be thinking about and cognizant. And little things. Just be aware that if you're a vegetarian or a vegan, don't have a black tea, for instance, within an hour of your meal, because the iron will bind to the tea. Or if you're taking calcium supplements, avoid taking those. They're best taken just when you're going to bed rather than with your meals, because they'll block the iron absorption. Things like this is, I think, more important to always be cognizant of.
Yeah, I agree with you. Maybe one more questions. We are coming with 12:05 already. Would you all right to stay, Tim? Just maybe a few more questions. You're fine?
Okay.
All right. So from Juliza, what about thalassaemic patients with excess iron? Yeah, we hear you. And maybe she got it the other way, that she understand that, well, in order for that matter, I have low immune system then affecting how because the other way around, by giving medications, iron chelation drug also used to reduce iron. What about the side effects of the immune system? I guess it's the whole system of this thalassemic, Tim.
Yeah, I look, this is an excellent question. Very, very relevant to this part of the world.
Yeah.
Thalassemia comes in two versions. Obviously, we have the major and the minor. In patients with thalassemia who are regularly receiving blood donation, so they're needing the blood to keep them effectively alive, there's a lot of extra iron that comes with that blood, and those patients often have what you've put here, excess iron. However, thalassemia minor, or patients with thalassemia who aren't getting regular transfusions, are as often iron deficient as any other person. So we treat with both oral or intravenous iron thalassemic patients every week or every month. So I could only say that in thalassemic patients, your hemoglobin's low because of the genetic disorder. Don't worry about your hemoglobin. Look at your ferritin. Look at the iron in the tin. Look at ferritin. If that is below 30, you need iron as much as a non-thalassemic patient. Just remember, it won't make your hemoglobin go back to normal. It'll only get it to wherever your genetic limitation will be. But it will give you all of the benefits from quality of life, the hair, the feeling, and possibly help avoid some of those other comorbidities that we talked about earlier. So iron for thalassemic patients is good, but check that you need it first.
Sure, I agree with you. Maybe one last question from Mr. Rosie, or maybe another one from Tunesh. Not fair, he got two questions from here and we answered both of his questions. Sorry, no worry, Tunesh. How come? Yeah, we can answer that too, don't worry. We answer this first, from Mr. Rosie. Hi, Mr. Tim. How can this strenuous exercise or activity cause iron deficiency? All right, it's just like it's the bricks of the house. How important is the iron? So over to you, Tim.
Yeah, look, the reason why strenuous activity can cause iron deficiency is multifactorial. The first is, and it's usually in endurance athletics, not in just one-off, but if you're an endurance runner, for instance. So what can quite happen often if we're running long distances, we have foot strike. Our foot is hitting the ground. It's causing rupture of the red blood cells, which are then excreted by the body. Every time we lose blood, we lose iron. So we lose a little bit of iron. Another thing that happens when we run, especially for a long time, is we sweat.
Yes.
Now, there's not a huge amount of iron in sweat, but if we're sweating a lot more, we have iron loss. So therefore, we can, again, lose a little bit of iron in our sweat. And the third cause is when you're doing exercise, it also causes some sorts of inflammation in the body. Whenever our body is inflamed, we have this protein called hepcidin, and hepcidin is upregulated, so it increases in our body, and it's like the man who's at the border patrol at the moment and says, sorry, you can't come into the country because we've already got too many people. So when we're doing this exercise, the next day our body's quite inflamed, so we're not in the iron, our food stuffs, that iron isn't being fully absorbed into the stomach or through the duodenum, through the gut. So basically there's three causes of iron deficiency or risks for iron deficiency through strenuous activity. So it's quite commonly seen, again, more in women than men, because if you add in Menzies on top of that, then it becomes much more of a risk. But we definitely see a lot. And by the way, just in case anyone wanted to ask, intravenous iron is not a banned substance, so it's not banned by the World Drug Authorities. It can be utilized in professional athletes as well. So we've treated many professional athletes. The only thing, if anyone is a professional athlete, is just talk to your doctor, because they have to administer less than 100 mils of saline in total, 100 mils of volume. So in cases of athletes, we'll often give the iron in less volume of saline. So, for instance, you can see on the screen there, this is a lady, Singaporella. She's based here in Singapore. We often see her running up and down the river. She's done lots of marathons. Wow. And you can see the way we're giving her iron there is we're giving her a very small volume. So we're giving it as what's called an intravenous push injection. We give that small volume because that way of giving iron is not banned. If you're an athlete and you're not iron deficient, don't ask for iron. If you're iron deficient, it will improve your running times. If you're not iron deficient, unfortunately, getting extra iron and having too much iron causes all the same signs and symptoms. So iron overload is just as bad as too little iron, but
I agree.
It's extremely common.
Yeah, maybe you can glance through little comments from testimonials from your side. We have a few more actually. Last or two slides. What is it? What do you have here? Or the other testimonial as well? Am I right?
So these are 3 testimonials, actually all from athletes. So this lady here, the Smiley Spartan racer, she does quite heavy trainings in these Spartan races. I'm not sure if anyone knows what they are, but it's basically craziness of doing every aspect of intense workout. It's a long distance running with going across monkey bars, and
all those
people that are absolutely crazy do this sort of stuff. And as you can see, our patient here who put this on Instagram, published this message. She really had a big difference, and iron can really help in those athletes who are low. But you'll also notice all 3 are female.
Maybe the last one also shows yes. Is it her? Is it no?
Yeah. So Yvonne's another one. She's another marathon runner, very avid marathon runner. She just hurt her foot actually, but now she's getting better. So she'll be back on the circuit soon. But she's done marathons over 7 continents, and again, for her, she had, similar to the patient who mentioned, normal hemoglobin but low ferritin.
Lower.
She said she was really struggling to do her training. So she'd go to training in the morning at 4:30 a.m., which is already, for me, sounds terrible. But she was struggling, and she said, I just didn't have the same desire to train. I couldn't push myself. She came to us after reading about us, and she had iron deficiency, no anemia, but quite absolute iron deficiency. We gave her 500 milligrams.
All right.
And she went back to training the next week and said 2 or 3 days later, and she said, wow, that's the best. I'm now back where I want to be. So it's more not necessarily just for athletes. It gives you that boost of energy, that feeling that you can do what you want to do again.
I hear Tim. She become Iron Lady.
Yes.
Same goes to all women. They become Iron Lady. Well, thank you for those the questions from the viewers. Maybe I can pop up here a few of this little comment from the viewers. Thank you so much. I have one more from Sarah. Thank Tim and Dr. Linda. Very beneficial sharing. She said she'll pop up soon.
Fantastic. I look forward to seeing you.
she popped by Robinson Road somewhere. You know
Yes,
that
yes,
with
in
the Iron
the city
Sweep
centre.
Singapore. All right. So got a few more. I guess that's fair enough for the questions for this time. I think we appreciate the time that from Tim was sharing. I guess it was a very tremendous and I shall say very comprehensive topic that we come up today, and as the comprehensive from you yourself with a very nice slides. And I guess this is not only for women, laymen, and also for doctors who maybe need some explanation why some of your women need iron, and hence we need to know about this as well, about this topic. All right. Thank you, Tim. Thank you for all the time. Thank you for all the viewers. Thank you for having us. Thank you till since we are like 15 minutes past 12 noon. Before we end, before I say bye-bye to Tim, I would love to say this, that please join us next week, same time. Our next topic with another distinguished speakers is a topic still around for women, is about women emotions versus hormones. Right? We would love to talk about this with the current situations, with the current pandemic. What else can we talk about? Yeah, please join us. Those maybe please lock your date. Please join us next week. All right. With that, Tim, thank you very much again. Thank you for the time and the explanations. I appreciate that, Tim. And with that, some summary from you. What is your aspirations? What do you think? What are the last message that we would love to send to all the viewers and women, especially? Please, Tim.
If I could achieve nothing else from this, I sincerely hope that especially the females or males with your female partners, encourage a checkup. It's a simple blood test. You can do it just whenever you're doing your other health checkup. Just make sure you ask for ferritin or your iron panel. Not serum iron, serum ferritin, iron in the tin. And remember, less than 30 is a problem. Even if your doctor says to you, oh, you're in normal range, remember, normal doesn't necessarily mean what you need to be.
Thank you, Tim. With that, I will thank everyone, viewers, again. Thank you, Tim. Till we meet again. I guess this will not be the last sessions you with me, Tim. We hope that we can get few more sessions that we can do in near future, so that we can share this to many women out there, inshallah. With that, Tim, thank you, everyone. Thank you. Thank you. Bye-bye. All the best.
Bye-bye.
Stay safe, Tim. Bye.